Welcome to another episode of Unconditioned Mind. Unconditioned Mind is a project of Awakened, which is a movement that seeks to contribute towards gender and racial inequality. And we are doing season 2, which is dealing with healing trauma, anxiety, depression. And this was sparked by my book, Awakened to My True Self, where I was really open to share my struggles with mental illness. And those chapters have really touched my readers who have realized that they also are struggling and they need to do something about it. Some may start a whole healing journey. Others may feel like, it's too much to deal with. But at least there's an awareness that there is an issue and one needs to deal with it. Today I have Sinovuyo Arosi, who is a psychologist. She's going to talk to us about psychotherapy as a healing modality. These things are very complex to us and there are many misconceptions. So she's going to unpack that for us. Sinovuyo, maybe you can start by just telling us who you are, where you are, what you do.
Yeah. Yes, my name is Sinovuyo Arosi. I'm an educational psychologist. That simply means that I treat and work with children as young as infancy up until the age of about, middle adulthood. I am practicing and working in private practice in Johannesburg and Bryanston. And I'm so glad to be here today to talk about this important topic.
Okay, thank you. We had part 1 with Sinovuyo, where we're unpacking mental illness, depression, and anxiety. And for those people maybe who have missed part 1, maybe you can just recap a little bit about what those are before we talk about psychotherapy as such.
Yeah. So people should definitely check out the previous episode and our time together. But I was just unpacking the idea of mental illness and disorders, specifically anxiety, depression, and general stress. We're talking about these disorders in light of how prevalent they are in South Africa. I'd shared that there is about, there's a statistic that 1 in 3 South Africans will have a mental illness or do have a mental illness currently in South Africa, and that even young people, they are sharing and presenting themselves in polls, talking about their awareness around needing mental health services. Depression and anxiety are two different disorders, but very closely related. I think I even say they're like siblings. Most of the time, people who have depression also have anxiety. People who have anxiety also suffer with depression. There's even a type of depression that has anxious features, we would say. And basically, when we're talking about depression, we're not talking about what people usually call "I'm feeling depressed," which most of the time they're referring to having having a low mood, or feeling sad or just down. But depression is a condition that really, really affects the life of a person. People who are suffering with depression are often sometimes accompanied with feelings of suicidality, and at times people execute and go ahead and find means to kill themselves. There's also the reality of depression that is around a deep despair, deep sadness, often tearfulness, and then at times depression can result in gaining weight because of the dysregulation in terms of eating, sometimes eating too much or eating very little, loss of appetite. It interrupts sleep. Depressed individuals sometimes show up with struggles with irritability and anger outbursts and that type of thing. And some of how depression shows up is in some senses similar to anxiety, in that in both of these, your decision making can be affected, concentration can be affected in both anxiety and depression. But mostly in anxiety, it's like the nagging worry and fear that sits with the person. With anxiety, there's this overwhelming hyperarousal, sometimes resulting in a physiological response, sweating, palms, struggling with breathing, heart racing, which, as some people know, can present or result in panic attacks as a result of the anxiety. Most of the time, I see people with these conditions who are quite high functioning. They getting on with life, doing day-to-day things, but living with these conditions. And so it's important for us to speak about what the face of these conditions looks like.
Yes.
And to name the conditions and name the feelings and the symptoms and what comes along with it. Because a lot of the time, depression, anxiety kind of has this elusive aspect to it where people don't want to speak about it. There's shame, there's guilt around it, and the stigma, which affects people being forthcoming and getting help, but also working through the difficulties that affect them and impact them, resulting in them presenting with these conditions.
Wow. I suppose, we have to help people deal with this thing, cope with it, manage it. I always worry when we're talking about managing, because what we are really looking for is freedom, from these things. How can we get to a place of freedom? Anyway, maybe let's start by just unpacking psychotherapy as a healing modality, because there's such a misconception out there. And because of this denial and not wanting to face up to mental challenges, we then have an attitude towards psychotherapy. And we want to demystify this thing today. And I just want you to just unpack what is it exactly, so that we have an understanding.
Yeah. So when we're talking about psychotherapy, we're talking about a talk intervention. It's a talk treatment. Psychotherapy, for the most part, won't involve us giving you a medication or something to drink or any of that. Though there are professional psychiatrists who do that aspect of treating mental illness. But in psychotherapy specifically, it's coming in and having a conversation with someone who is going to put themselves aside and just listen to you. It's supposed to be a space where there's no judgment. Mm-hmm. So, psychotherapists come into seeing their patients and the clients that they are treating with an open mind and a wanting to hear you out, to understand who are you, where are you coming from, how are you here sitting across me. It's talking, it's unpacking every detail, depending on, obviously, on the different modalities of psychotherapy, which we'll get there, of your life and how you've become the person that you are sitting across from me. It's got its foundations in Western schools of thought. But I suspect that our people, our indigenous people in here in Africa, have also used talking and story sharing and narrative exploring as a way of unpacking people and the person and the people's experiences. So I don't think it's too far or too taboo from what we know, though maybe the look of it or the context of how that has been explored in our context historically has been different. But yeah, the work of psychotherapy, it's a conversation. I want to, though, say that while also keeping in mind that it's not like you sitting with your friends, your girlfriends, or your colleagues and venting about your whatever's going on. It's not like sitting with your spouse and having a deep, meaningful conversation, though it is deep and meaningful. It's a treatment. Mm-hmm. It's a therapy, which means it's an intervention. It seeks to address a condition and work through and hopefully remediate symptoms. Mm-hmm. It's there's lots of research about it, lots of studies about what works and what doesn't work and the moving parts of it. It's a very technical thing, which is why psychotherapists, which in our country are psychologists, go to school for years to train and get the technique of it to the T, because it's not just about let's just sit and talk and just there's an intentionality to the talking. There are things that we are working through and targeting, and it's bi-directional. It's two people interacting and talking through and working through whatever the difficulties coming in are.
I think just give us understanding between all of these professionals. What is the difference between a psychologist and a psychiatrist and coach? There's a lot of coaching, life coach, and a lot of coaching that is going on nowadays. And how does one determine which professional they need?
Yeah. That's a very important part in talking about, part of talking about this, treating mental health conditions. So there's firstly the psychiatrist. A psychiatrist is ultimately someone who went to medical school, got an MBC, HB, I think that's what it is, and then specialized in psychiatry thereafter. So
which is what? What is psychiatry?
So psychiatry is the study of and the treatment of mental health conditions. So they can work with people with depression, anxiety, schizophrenia, bipolar, all of that. And what their area is on prescribing medication to treat the condition. So the same way your GP will prescribe flu medication for flu, or a gynecologist does their work in gynecology, they're a specialist doctor, or a pediatrician. They just focus on mental health conditions and treating them with medicine.
So why do we need medication for mental illness, for instance?
It's because, as we revisited in our previous conversations, that these mental health conditions have a real effect and origins in brain functioning. And so when they prescribe an antidepressant targets specific neurotransmitters and brain chemicals, which maybe at some point you should have one of those professional psychiatrists to come and explain the technicalities of that. But the medication targets the chemistry of your brain so that the chemicals are kind of stabilized so that you can function.
Okay.
So that's what a psychiatrist does. Then there's a psychologist.
Yes.
A psychologist studied psychology, and basically that's a study of human behavior and just unpacking our beliefs and attitudes and how we are in life in relation to others and the circumstances we find ourselves in. A psychologist has studied, in South Africa we do a bachelor in psychology, we do honors, that's about 4 years. And then we do go through a master's training, which encompasses both a practical part, which means seeing patients, getting practice in the techniques of psychological treatments. And then there's an aspect of it that is research-based, And there's a part of it that is theory based. And we spend the master's training, which can be anything from 2 to 3 years in South Africa. And then you write a board exam thereafter. You get examined by the Health Professions Council, and you get registered under, I think there's about how many categories in South Africa? There's a research psychologist, there's a neuropsychologist, there's a clinical psychologist, there's a counseling psychologist, and an educational psychologist in South Africa. And so those people accept the research psychologist. The research psychologist specifically focuses on researching psychological phenomena, doesn't treat people. The other categories, they sit with clients with conditions and administer treatment. So that's a psychologist. Now, in South Africa, which is different to, I think, the UK and the US, psychologists are also psychotherapists. So they are these professionals who've gone through the studying and all of this that I've mentioned, and a part of their training is in the training of psychotherapy, which is an intervention used, like I said, it's a talk intervention used to deal with the conditions, psychological conditions and mental health issues. So that's one category. Then there's counselors, registered counselors in South Africa. And those are people who have started the journey somewhat towards being a psychologist, but they are at a more junior level, if I can say it that way, in that they have completed the training up until honors level. And they also go through an examination and a registration with the Health Professions Council. However, they cannot treat severe and significant conditions. They do more short-term work, and their interventions are more short-term, and they get just to the surface of what things are and kind of help give strategies to deal with what may be going on with the person at the time. Should the conditions persist and get more worse or more complicated, they usually escalate to psychologists and psychiatrists. And then there's the life coaches.
Yeah. Yeah. There's so much of that going on today.
To be honest with you, I would probably prefer for them to come and talk to you about what they do. But my understanding is that they are more of a guide or in a mentorship type of sense, in that they are quite intricate in your day-to-day life. What are you doing? And give you strategies to deal with what's going on in your life. I don't want to say a lot in case I traverse boundaries that I shouldn't, because I think there's a lot maybe, and there's some stuff that they can offer that people would want to, I mean, already people are approaching them, it's out there, but it's certainly not psychotherapy that should get with a life coach, unless, which they are, psychotherapists or psychologists that are both psychologist and life coach, and they would probably have to be quite tactful in how they maneuver those two categories as they see people. But yeah, it's quite different to what psychologists do in their capacity in administering or treating using psychotherapy.
No, I actually wanted you to clarify this, because in this whole issue around denial and stigma and things like that, I find that people are opting for life coach because, a life coach sounds, normal and sexy, when in fact they actually need help in terms of their mental conditions. And because also there's a lot of, self-help work that are there, books out there and so on, people opt for those kind of modalities because they're not comfortable with psychotherapy. And people need to understand that these three professionals are completely different, and you're getting different help from them, so that you make a conscious decision. What exactly do you need at this time? So you spoke about modalities around psychotherapy. Will you just unpack that for us so that we understand what those modalities are?
So under the umbrella of psychotherapy, There are many, the different theorists, of course, because we're trying to do our work based on research and then quite an informed and thorough approach. But there's lots happening under that. There's some solution-focused psychotherapists. Basically, they also work in-depthly with the person as a psychologist, but targeting specific events and things that are happening in your life quite succinctly and directly. Mm-hmm. There's also more narrative-based psychotherapy who use all sorts of creative ways of exploring who you are and your narrative and your story in general and what your story means and exploring that. There's also cognitive behavioral psychotherapy, which is very, very popular, and there's a lot of those in our country as well. And as the word suggests, that it targets cognition, your thinking, your thought processes, why you think the things you think, and where the thoughts come from, and how they affect your behavior. Mm-hmm. So there's a lot of that also happening, and I think the modality that I work from is what is called the psychodynamic psychotherapy perspective, which focuses a lot on your history. Mm-hmm. It's a more in-depth and most of the time quite prolonged way of working, which seeks to excavate your whole journey. I mean, at times I sit with patients exploring the beginnings. Especially when working with children, we'll start with the parents and talk to them about how did you conceive this child? Was it planned? What were your thoughts when you found out that it was a boy and not a girl? It's quite an in-depth work, tracking and tracing the journey of the person up until they are sitting across from me in psychotherapy. And so all these things, all these modalities, fundamentally, they require the psychotherapist to be very curious about the other person and to be selfless, to remove oneself in order to explore the other person's life and what they bring at that point when they're sitting across from you. I think those are some of the most common ones, but there's all sorts of interesting things happening in the space of psychotherapy, targeting specific disorders like trauma-based interventions and that type of thing. And so it's also important, as we talk about that, to let people know that it's important to ask a potential psychologist or therapist, what modality do you use? Mm-hmm. How will it work best to help me with my challenges that I'm bringing or my difficulties? And also for people who are seeking out services to research. Most of the time, therapists and psychologists will write, whether it's on their website or on their social media pages, what modality they use, and for you to do a bit of research about that modality and find out whether, is this something, do I want someone to help me target specific things? Okay, maybe it's best that I go to a more solution focus. I want to change my thoughts or how I think about things, about a specific thing. Maybe I should pursue a more CBT-based therapist, or I want to go through a more exploratory, open-ended journey in my therapy, and maybe I should pursue maybe a more psychodynamic-based psychotherapist. But ultimately, all these modalities, they are centered around the therapist and client, or therapist and patient relationship, that there needs to be a rapport built between the two of you.
Yeah, because I often hear people saying, I went to this psychologist, but after a while we were just not connecting. I felt that I was not getting help. Or people have gone through psychotherapy for a very long time. Yeah. They still don't get help. Yeah. And I always wonder, how do you make those decisions? How do you know when you are getting help and when you are not getting help, so that you can make an informed decision and not waste many years in psychotherapy and money and not getting the kind of help that you seek, because you went there because there was something troubling you that you needed to deal with. And I sometimes suspect that, as we are saying, it's a talking session. So people use psychologists as a crash kind of thing, so whenever I just want to offload,
Vent.
I'm not saying there's vent. I'm not saying that is not necessary, but just help us, how you've unpacked the different modalities. But as a lay person, I really don't know. Talk to us about this chemistry thing, and why do people go for a long time and they don't seek help? And they don't get the help that they were seeking. Yes, that's what I mean.
I mean, there's lots of parts to that, in the sense that I definitely would say that it's important to talk with your therapist about what is happening between the two of you. By that I mean to say, I've been here for 3 weeks. I've been here for 4 weeks, seeing you once a week. I'm still wrestling with this and this and this. What's going on? Because you're paying them, first of all.
Yes.
But also the reason why you came is to see some change. And obviously, the first indicator of whether this is working is seeing your symptoms be alleviated over time, and getting some insights about yourself, or because it's good to go into therapy with some sort of goal or targeted thing that you want to get
achieve.
Achieve. It's important. I mean, it's a very important, even for us as psychologists, to ask that, like, okay, you've approached me now. What do you hope to get out of this? And that also will inform whether I'm the right psychologist for what you're looking for. Some people will come and say, I actually would like to leave, or when these sessions end, I want to have a guide or 10-step guide to X and X. And I'm like, actually, I don't provide 10-step guides to whatever the issue is. So maybe I'm not the one. Maybe you should go to a life coach or whatever the issue is. So a part of the initial part of the therapy is assessing whether I'm able to provide the service that you're looking for. Sometimes it does mean I must educate you, psychoeducate you, but actually you're telling me this, but in my sitting with you, I'm observing X, Y, and Z. And maybe you need to consider that actually it's not about just getting quick fixes or 10-step. It's about exploring this glaring other part of your life that's really affecting your functioning. So there's certainly that. But I've also found that there's a part of not knowing what to expect in therapy that makes it terribly uncomfortable. You don't know what's happening. I don't know what to say. It's a bit awkward. I've never really shared these parts of my life with anybody before, and so here I am, and I'm kind of trying to figure out how to bare my soul before this stranger to start off with most of the time. And sometimes that's what makes people freak out and want to be like, actually, this is not working. Never mind. I don't want to do it anymore. And so a big part of the initial stages is also about tolerating the discomfort, how awkward it can be, and how it can be anxiety provoking. And at times, I mean, I've sat across patients, sometimes the symptoms get worse before they get better. Because now
we are unpacking
we're digging
things.
now. We're going straight into the muddy, messy parts of themselves. I can think of patients who come with, I can tell that there's anxiety, and then we go session 1, session 2, and they start having panic attacks. And then it's like, whoa, there's something wrong about this therapy. Why am I not? And then
why am I getting worse?
And of course, it's not to say we take pleasure in that. It's just that it's part of the work, the digging and the dealing with the issues. And that's most of the time is an indicator that there's more work that needs to be done. So going in with that open mind that it will be uncomfortable. It is a new and foreign experience. It's a new person that you're meeting, and you bring in yourself in such a vulnerable way. Of course, it's going to bring about all those uncomfortable feelings. The other side of that, though, is not to say that people should just sit through the sessions, even when it's clear that it's not working. Because it's, like I said, it's costly.
Yes.
And it's a waste of your time. It's a waste of your time. And even that therapist could be helping other people who would be more suitable for the service that they're providing. So that's why I'm saying it's important to bring to your therapist, listen, I've been sitting here for X amount of sessions. This has helped, this hasn't helped. Or when you say this or when you do this, it affects me in this way. Therapists, need to, part of what our work is getting the feedback from our patients and working through that.
So on this issue of how long should therapy be, and how to determine if you are, getting help, because as we are saying, you go through these various stages of things getting worse or whatever. In your mind, you may think that it's part of the process. How do you differentiate when, no, this thing is just not working, or is it also a healthy thing to have a therapist? Nowadays, I hear people talking about my therapist this, my therapist this, and I don't know whether, is it like a GP now, you have a permanent relationship with a therapist? How does that work?
Sure.
What is normal? What is healthy? What is not healthy?
Yeah. I mean, to start with the last thing first, it's our people in South Africa have lived through some of the most unconscionable situations. It's bad. So there's a compounded trauma, just difficult situations that people have lived through. And so I have seen that a lot of the time, and most of the time, people do need a long-term a treatment process. Sometimes people come into therapy with this one thing, and then, of course, like I said, you find out that actually there's a lot of other things that are happening. Some people come into therapy for a self-exploratory reason. They're like, I just want to understand myself. And so in that sense, it kind of takes on it's a permanent thing. Every Tuesday at 5 p.m., I go to therapy. I mean, some people have been in therapy for years, and that's good, especially if you have the means to do that and you feel like it's helping you make sense of yourself in the world. Okay. So in that sense, it becomes quite a permanent thing, a more long-term thing. However, there are people who are dealing with symptoms that are quite adverse and affecting them in serious ways. And so a big part of the intervention is to alleviate the symptoms.
Yes.
And it's a good benchmark starting place to say, I want to work through this. I'm struggling with panic attacks and I want to get to a place where I'm no longer having panic attacks. Or I haven't been able to get out of bed for months. Or every job I'm at, I keep getting fired, or whatever the recurring ongoing thing. And you're saying you want to target this and get to a place where you can function.
Or relationships or love relationships.
Exactly.
I'm just struggling with love relationships. Yes.
And the interesting right now in my practice, I've got a lot of young people who are struggling to be adults, to take on responsibilities, to separate from parents or caregivers, to start a life. That's a real thing. And of course, I'm saying that bearing in mind that there's a socioeconomic challenges in our country, young people struggling to find jobs, and that, which is a serious thing and a factor to consider. But it's like sometimes you go to therapy to be able to start a new way of being in the world. You're like, I just need someone to walk me through transitioning from being a university student to being a functioning adult in the world. Some people come to therapy, I'm going through a catastrophic divorce, I've got 2 young children, I've got children, my world is upside down. And so the work of the therapy is to help you move from this mess that you're in to a more stable, functioning space where you've got your feet back on the ground.
Okay.
And so that's why I'm saying it's important to have your own goals going into therapy so you can measure for yourself. Am I getting better? Am I getting to a place where I'm functioning in a more a helpful way, in a more meaningful way in the world? And to then be able to have review moments with your therapist to say that we've had 10 sessions now. Where are we?
Yes.
What does this mean? And to take into consideration both your views as the patient, but also to hear out your treating clinician who says, I think you've made great milestones, but I think we need to work through this now. This is going to be important so that you don't find yourself back in the situation that you were in coming into the session.
That's actually quite, so that people can make those decisions, because I find that even in my own healing journey, that it's layers and layers and layers, and when you remove a certain layer, then it's only then that you can see, but there's actually this other underlying thing, and you can start that process. Like, for instance, I started dealing with rejection when I acknowledged that I was suffering from rejection, which I was denying for a long time. And it was a painful process to unpack that rejection until I felt, comfortable that I had dealt with rejection. But I still felt that, no, I'm still not okay. There's still something wrong. And I kept digging, and I found that, healing is a journey, and you must be willing to, go deeper as you deal with certain aspects. And it is okay when you remove a certain layer. For instance, I found that it brings a lot of freedom, and peace around that issue. So a psychotherapist then will help you delayer these
peel bit by bit.
Peel bit by bit, which is why sometimes it takes long. Right.
And on that very point, there's also the reality that as you kind of graduate, move to different stages in your healing journey, okay, now you passed your divorce, for example, as a mother, you're now back in your feet, your children are growing, and then you get to a point where your children are asking you stuff about, and then that brings up another part that you didn't quite anticipate. And at times people need someone to walk through that with them around what it means to parent children in light of what they have gone through with you. I know even with what I'm sharing around, a lot of patients struggling to step into adulting.
There's a lot of that nowadays. Lots of that.
So that they go in.
As parents, we normally say among ourselves, our children are not as resilient as we were, because you just see there's just this fear, I suppose, because of the socio-economic conditions, because it's so comfortable at home. Whereas we wanted to get out of home so that we can create a life for ourselves. But for them, it's so comfortable at home. And maybe my parents are really successful. Will I be able to create that kind of success for myself? Will I survive outside my parents, which is really worrying. It's really worrying.
No, it's there, and it's so interesting because when you go on social media, for example, everybody's talking about adulting. Everybody's complaining about it and acknowledging how difficult it is. But I think there's a lot around the fear of exploring that, the weight of the responsibility, the stuff around. I mean, we were talking about the emerging persona, the sense of self, independent of your family or your background. There's a lot to tease out around that we do in psychotherapy in helping usher young people into adulthood. It's a lot of work in therapy. And of course, there's the reality of the traumas that they are coming into trying to be adults with that affects that and at times can impair that. It's very complicated, but it's a common thing. It's a common thing, and a lot of what you find, maybe they're struggling with this, and then you find out that actually the difficulty is to individuate and step into the world and own yourself in the world and be able to function.
Okay. Can we just go back to, I just want to understand more, when we were talking about in the previous session, depression and anxiety and what actually happens physiologically, and this whole thing of this rogue mind, fight, flight, syndromes, and the neurological aspects of that. Just give us some understanding around that.
So the fight, flight, freeze response is an innate response that we have as people in order to protect us and for survival. It's quite a primal and instinctual aspect of who we are as people. And so, of course, we've got a complicated machine like the brain or the nervous system, which is part of our makeup, that kicks in and I mean, there's all sorts of things about also when you take in consideration your heart, which is part of your respiratory system, that also kicks in. And we see that the brain, the heart, the sweating, for example, is involved in a condition like anxiety. And so when we're faced with a life or death situation or a highly traumatic event or a circumstance that triggers that survival instinct, those systems in our bodies are activated
automatically.
Yeah. And so that's why, I mean, that's how the condition of post-traumatic stress disorder came about, was through soldiers who were going out in war and constantly in life or death situations, and their bodies constantly responding to being aroused and responding to this life or death situation. And then they survive, and then it's time for them to go back to society, and they can't function because their system, the nervous system, which involves the brain and down to the spinal cord actually, is on overdrive. There's hormones like cortisol, for example. That's why when we talk about mothers who are stressed during pregnancy, how that affects the baby, is that the cortisol levels shoot up, which impacts your chemistry, your brain chemistry, and that's part of this fight, flight, and freeze response. And so when we talk about like the symptoms of anxiety, that there's a hyper arousal, the panic, the angst, the sweating. It's your body responding to this urge to fight or flight. It's creating opportunity for your body to respond. But if that is triggered by something like being in social settings or being out in public, which is a real thing, some people, they get panic attacks and they get very activated in being in public, which is a real thing and a disorder. It kind of throws you off because your body perceives that there's a danger.
When there's no danger.
in a typical sense, there is no danger. You're just out in public. There's nothing wrong, but your body responds to that. Sometimes, most times, it's because you have had an instance where something tragic has happened in that way, and so. I mean, there's a lot of sophisticated neural pathways and all sorts of very interesting things that you would see if you draw the blood of someone who's in a stressful condition versus not, or someone who's having a panic attack or not, and all of those things. And we've had studies where people get put all sorts of sensory stimuli to test and examine how they're functioning in the middle of these states. So all these things, they have a biophysiological base to them. You can trace them back to what happens in the body and the central nervous system. And so when we're treating, that's why most of the time in severe cases, it's very important to have both a doctor, a psychiatrist involved, and a psychotherapist. In fact, there are studies that show that some of the great improvements or drastic improvements in the people's mental health is when both these professionals are involved in the work. You're talking through it in psychotherapy, and you are taking the medication and it being reviewed from time to time. Because like we said earlier on, that not one pill fits for everybody and works for every condition.
Yeah. I mean, we spoke earlier around, there's children who are struggling with, moving into adulthood. But I've been thinking that this whole issue of, anxiety, depression, mental illness, that has become such a big problem in society. Wondering, what are the real reasons? As we're saying, it was there before, but it seems to be at alarming levels today. What are the real reasons? Are we living in a more stressful world? Are we dealing with things that maybe our ancestors didn't deal with during their time? And I also thought about, there are so many changes in the world that are taking place. People there's this sense of seeking more freedom. And then we walk into corporates that have a certain culture. We are expected to fit into a certain box. And that desire within yourself for freedom is really struggling in this situation where you have to be this person, behave in this way, and your financial well-being, is involved here, because if you don't perform in a certain way, then you are impacted financially. So I can imagine that brings a lot of stress. That there's issues of, I've been working a lot with inequality, racial and gender inequality, and all these other LGBTQ kind of situations that have made the workplace very complex at the moment. And people are tired of racism, for instance. People are tired of patriarchy. And there's just this struggle of having to navigate your way, this desire for freedom, and walking into spaces where, there's a certain stereotype that you have to fit in. Is that not also contributing to this sense? And those LGBTQ, I don't understand that space, the gender fluidity and things like that you are still trying to find yourself, and you're struggling with these things, and you're living in a world that expects you to fit in a certain category, when inside maybe you are feeling that, I'm in a body of a woman, but I don't feel like a woman, or I'm in a body of a man, I don't feel like a man. And also, I just want to add this whole dynamic of religion, for instance. People are really struggling with religion because of, again, it's constructs of control. You have to behave in a certain way. People are tired of politics. So there's just a lot that is going on in the world. And as people are trying to navigate these things, there's this resistance, for instance, around gender and race and politics and religion and all of those things. What is your sense? What is your research saying around why these high levels and these struggles that people are going through? And I don't even want to add this sense of there's more spirituality in the world. People are starting to seek more understanding of their spiritual beings and their place in the world. Are they human beings? Are they spiritual beings? Am I a soul or just a human being in a body? So there's a lot.
Yeah.
There's a lot. Yeah. Just talk to us around these dynamics that are happening in the world.
I mean, it's clear. I mean, it's interesting you didn't add COVID to that, because that's another.
COVID is another thing. I mean, there are lots of people who COVID has changed us, and there are lots of people who are leaving jobs or have left jobs because of what they found about themselves in COVID. So, yeah. COVID added a big part. Yeah,
certainly. I think it's clear from the work, sitting across from people, trying to support and help them, but also from the reality of the research that people are the stresses are just mounting. And the thing about stresses, environmental stresses, is that they act on people. The stresses directly impact us. It's you just can't avoid the inflation rate.
Yes.
It's just in your face. Whether you're a household of two, whether you're a single person, it's just there. So there are things that are out of our control that are acting on us, the stresses. In our context, like you say, there are many other things. We are, as a country, have this racialized history that is also acting on us. And like I said, with patients, people come and sit in for therapy, they bring in their history with themselves. And so do we as a nation.
Yes.
We're living the repercussions of our history.
Yes.
We
all of us, black and white.
All of us.
Yeah.
All of us, even people who come and visit South Africa,
yes.
They are stepping into a bit of a channel of a time and space and period influenced by our history as a nation, which affects our sense of being shared, our collective way of being together, and also our individual experience. And so that makes for a cacophony of illness and suffering and pain. We have the shared distress and pain of our country, things that have happened in the past and things that continue to happen.
Yes.
When you think about the crime, the violence,
yes.
GBV, all of that, there's a shared sense and a shared awareness around what it means to live as a woman in South Africa,
yes.
what it means to live as a
black
person in South Africa, what it means to live as a queer or LGBTQI plus person in South Africa. We have a shared meaning around what that is.
Yes.
And then, of course, there's your path, your individual path and your individual history that goes parallel to that. And so how can there not be so much pain and suffering and psychological distress?
Sure. Yeah. In fact, when you're talking about, the racial aspect, I actually had Professor Gobodo Matikizela the other day, and we're talking about, we always look at race, as, the black people who are the victims and want to deal with racism. And we don't understand how white people are also affected as things are changing in South Africa.
Yep.
Where, for instance, they are responding. Remember, they saw superiority as part of their identity. And now that their whole identity was based on a lie of black people being inferior, and now they're finding in these universities and workspaces that in fact that is not true, and they're struggling with that identity, and often it shows itself in violence, sometimes physical violence, where I saw this video of this white lady and two of their children beating up this black girl who I think because she was confident in herself. So you could see from the expression how threatened these white little girls were, that you have to go back to being inferior because my whole identity is being threatened.
Around that.
Right. So that is also adding a lot of stress. As I always say, we're dealing with a black ego and a white ego, or a male ego or a woman ego. So even with men, the patriarchy is resisting as the structures of patriarchy are crumbling. There's this resistance, which is why the violence that we see that is out there, and so there is just South Africa, let alone the world. There's a lot that we're dealing with that are adding to this response. And I talk about how when then you encounter. Remember, race was all about power and all of that. Yes. So you walk into these environments where that power thing is still there, and you have to opt: do I self-abandon here so that I can survive, or should I stand up for who I truly am and take the risk of losing my job or not, being promoted and things like that? So, it's really just a myriad of things that we're dealing with generally. So I want now to talk about how do I find myself in all of this. There's a lot of talk around self-love and finding your authentic self, and of course parallel to healing as we're talking about. You're still healing your traumas, your wounds, your thing, and there's this thing of I do want to find my true self. I do want, because out of this trauma there was a lot of rejection, self-rejection, these feelings of unworthiness that we spoke about, and help us understand how do we find self-love? How do we find our true selves? How do we find our authentic selves? And how do we know we found it?
We spoke in the previous episode around the idea of being reflective. You shared a story about looking back, because the idea of finding a self, the word finding means that there's an operation you need to get into, you need to seek. That's why when I was even talking about therapy, like an open-ended therapy, there's a part of that's about exploring. You don't know where you're going, but you're going to walk. You're going to hold a torch, make sure you can see on your feet, and you've got someone holding your hand, which is your therapist, and you're navigating an uncharted territory.
Yes.
When we're seeking to find ourselves, I think what people are generally trying to say, they want to understand themselves.
Yes.
They want to understand why they do the things they do, what got them where they are, why do they have a tendency or bend towards certain things and not other things. It's a longing to understand yourself, but I would also say that a longing to have others understand you. There's a part of wanting to present yourself in the world, and not misrepresent yourself, not abandon yourself. You want to present yourself truly with all that you are and everything that you bring, but not wanting to self-denigrate or criticize yourself and therefore abandon yourself, or to have a world that is so harsh and so rigid in its view of you that it feels like you have to be accepted or seen or understood, you have to abandon yourself. And so when we're talking about the self, I mean, I can't think of a better place to try and explore that than in therapy, to examine that and to unpack that, who you are, the people that you come from, and how the people that you come from have impacted who you are, and that type of thing. When we're talking about self-love, I think that's more probably about an acceptance
of who you are,
the self, of who you are. Self-awareness, you want to understand yourself. Self-love is to want to accept who you are and say, this is who I am. I am a village girl. I don't have this and that, or I come from this background, and this is what I am. This is who I belong to. These are the people that love me, and these are the people that I love, whatever that looks like. This is where I want to go in life. This is what is meaningful to me. And so to accept all of that, not try to shape shift and kind of squeeze yourself into what people want you to be, which most of the time, often they're not. You'll run into trouble trying to squeeze yourself into something that doesn't feel authentically true to who you are.
Yes, doesn't resonate with you. But I mean, that is difficult in the world we live in now with social media, comparing ourselves to others. I mean, you look at others and you feel so small that, I mean, why can't I be like so-and-so? Why can't I achieve like so-and-so? And unfortunately, in that whole process, because we are not comparing apples with apples, for instance, you'll always find yourself wanting. Whereas if we could focus on self-acceptance, self-love, so that you're comfortable to be yourself, and you are not always, too critical because of that comparison. When we talk about finding your true self, what I found is that it's a journey, really. Because, I mean, in my life of ups and downs, because of the, traumas and self-sabotage, and I would end up losing myself, it was always so surprising to me that when I find that self-regulation and find myself, how I would, begin to function again normally in society and build even bigger things, that, there must be a real me, a real self that is always there, even in the darkness of the moment where I think I've lost myself. I was there. I was always there, and I could go back and find that self. And I suppose that we are growing and evolving in life, and we must accept the fact that it's not, a sprint of a one-stop thing, that you may find a certain aspect of yourself, and then something happens that forces you to dig deep and find another aspect of yourself that is part of the journey. And in this world that we've just described now, how difficult it is to actually find yourself when religion has defined who you are, and you become, like myself, for instance, I just walked out of religion because I just found that I was trying to find myself, and religion keeps putting me in a box that this is who I am and this is how I must behave and act in the world. And when I walked out of religion, I just found that freedom to just explore and find myself and find what am I comfortable with. Because some of the things that they said I should be uncomfortable with, I no longer find it uncomfortable. Like, for instance, I'm willing to accept LGBTQ people because, I mean, they're trying to find themselves in the world. So all of those things that were being imposed on me, the ideas that were being imposed on me about myself, about God, about life, I find that, now I have the freedom to explore that for myself and make my own decisions around who I am, who God is, where can I find myself in the world. And again, this whole thing of politics, people are really tired of politics because there's this edge and a sense for freedom that is there. But as we close, I'm really bothered by the state of brokenness in the world, how we were raised by broken parents. We became broken parents, raising broken children. And I made a decision within my own family to walk, through a healing journey for myself and my children, so that my grandchildren at least are spared from this vicious cycle of brokenness. Yeah. Just talk to us about that as we close.
I mean, you've said a lot there, but what's weighing on me as you say that is the reality and the undeniability of the transgenerational transmission of trauma. Mm-hmm. That's the cycle of it. That, I mean, I've heard a colleague of mine saying the best gift that you can give your children is to heal yourself. To work on you so that you do not transmit that onto your children. You do not unnecessarily wound your children.
Yes.
And now there's also a voice of reason that says it's impossible not to wound your children. Right? There are people who say that, colleagues that I respect who will say that. And I think there is also something to that. It's just that it's to the degree that the wounding that will happen that can be a question to be asked. That you don't want to just pass it on, parcel, as it is, the way you got it. There you go. And so that's just the how the lineage goes. Because that's a real thing. That the brokenness in our world is because of a transmitted, transgenerational passing on of trauma from the great-grands to the grands to the parents to the children and grandchildren. The work of healing it's a hard work. Yeah. It's a messy work.
But one we need to undertake.
Needs to be done
by everyone.
It needs to be done.
Yeah.
It needs to be done, and at whatever cost it comes.
Yes, yeah. It's troubling though, and I just feel there's an urgency in dealing with these issues, which is why we really need people like you. Which is why I have this podcast. So that, I can bring professionals who can begin to unpack these things so that we demystify them. So that each and every one of us, black and white, man, woman, child, parent, citizen in a country, we can start to, walk this journey of healing ourselves so that future generations don't have to go through the things that we've gone through as a society. Thank you so much, Sinovuyo. This has been, again, an enlightening session. I feel, I now understand psychotherapy in a way that I didn't understand. I was actually sitting here and thinking, maybe I should explore this, because I've always been, dealing with my own healing journey myself. I've never, except going to a psychiatrist for 6 months, I've never really explored psychotherapy. I was actually thinking, it's actually not a bad idea to actually consider it. Yes, thank you so much. As we say at Awakened, if you take time to find your true self, you'll begin to function from your authentic power. Thank you.
Thank you.